Well, my name is Lyle Harrison. I initially, first visit to Next Health was I think January or February of 2019. It was actually a bit coincidental. I'd become very concerned about a coronary calcium score that I had. I initially was tested back in 2016 and received the coronary calcium score. Now this is after my primary care doctor had said, your blood pressure's low, your lipids are a little on the high side, but nothing alarming, so you're in very good health. He told me that, but despite the fact that one of my family is dying of heart disease, so I thought, well, there's not really satisfied that answer, so I decided to take it upon myself and get a coronary calcium score done. I came out very high, it was a 327 at the time. So at that point, I was referred to a cardiologist who made me put me on a heavy statin at the time, and said, well, we're catching this early enough, we'll stop the progression of your calcium score, and we're putting on a statin, which you probably should have been on for the last few years, given your risk factors of family heart disease. So, thought everything was going well, and we went back for follow-ups with the cardiologist, said everything's looking great, we've gotten a handle on this early, should be no problem. It was in June of 2016 I had the first scan done. So, 2018, December 2018, I asked him if we could get another test done again, and his answer was, we can if you want to, but everything's looking good. Your good HD, your good cholesterol's up, your bad cholesterol is down, everything's controllable, and don't see an issue, but if you want to have it done, we'll go ahead. Went in, got a second calcium scan done, and my numbers had not frozen or regressed, it actually had tripled in 2.5 years. So at that time, not a doctor, not a cardiologist, it was pretty evident to me that my lipid levels were not the issue, and statins were doing nothing for calcification of my heart. So at that point I sought out, did a bunch of research on my own, and started looking at other factors like inflammation, insulin resistance, possible metabolic syndrome, and other things that were going on, because I knew I had also history of diabetes in my family, and my blood sugars were high. It was hitting 5.7 A1C, so pre-diabetic levels. The chelation therapy obviously did what it's supposed to do, which was removing the heavy metals, which is what it's FDA approved for. What I did not know at that time if it was making any difference in my calcium levels. And I know today, because I just took another CT scan, that probably was directly resulted or a contributing factor in my calcium score being cut in half in only 1 year. Now this is after tripling in 2.5. So a lot of other changes, obviously, through the coaching of Dr. Habib. He really helped me with altering my diet, which I'd already started doing, but just gave me more information on inflammation markers and what I needed to do. So radical change in diet, giving up refined carbs and sugars, and a good supplement program. So it's been a holistic program for me, so it's hard to isolate how much the chelation did. Obviously remove the heavy metals, and that's a heavy contributing factor to any kind of coronary heart disease. I believe, though, there's no way I could have cut my levels in half without the chelation having something to do and some impact to that, at least assisting with everything else I'd done and the use of supplements and change of diet. As I joke with the staff here, it's my relaxing time of week. I get to sit in a comfortable chair and catch up on the news or work on my computer. So it really is, I thought there was no way I could go through a couple of hours of IV treatment every week, but it actually has been a pleasant experience, not a bad one. Fantastic. To say that it's the best medical care facility is an understatement, because that would be insinuating that's even close to other medical practices. It's a whole different level. Really feel like the staff there treats me like family. I feel like I'm family. Again, it's something that is always a pleasant experience, and not something that I ever even dread or try to avoid or procrastinate doing. It's actually time well spent every week. Very different than most doctors who, come out in a lab coat and basically try to quickly assess your problem. without any direct interaction or dialogue with you and tell you what you need to do. I look to Dr. Habib as more as a mentor, player, coach. He works with you in dialogue, and he's humble enough to say, look, I don't know everything, but let's look at where the evidence takes us. And if you have something, and because I did a lot of research on my own, he was very interested in hearing about that and getting my input and opinions, and he's guided me from there. So again, very different relationship here at Next Health than any other patient doctor experience I've ever had, and that's why I'm still here.